Health advocates are speaking up about a growing need for inpatient mental health facilities, preferably specifically for children and adolescents. That is after a teenager attempted suicide while being housed at the state's Department of Juvenile Justice. WIS reporter Ashley Jones has been following this story for us and joins us live in the studio after speaking with one of those advocates. Ashley, there are so many questions about this story, about whether this young person should have been arrested, certainly whether they should have been taken to DJJ, and what kind of supervision they had while they were there.
That's right, Judy, and we're looking into the background of all of that information, but we're starting right here. Public Psychiatric Residential Treatment Facilities, or PRTFs, are meant to treat mental health patients under the age of 21. There is one public PRTF in the city of Columbia and several private facilities throughout the state, but Bill Lindsay, that's the executive director of the National Alliance on Mental Illnesses, or NAMI, says we need more. Lindsay says we are in the middle of a youth mental health crisis, not just in this state, but across the nation. He says in some cases you see children who suffer from mental health conditions end up in the juvenile justice system because of behavioral or obviously issues with law enforcement. Lindsay says what should happen with these kids is they undergo a psychiatric screening process before being housed at a facility like DJJ. If it is determined that a child is suffering from a mental health crisis, then that child should be released to the custody of the Department of Mental Health and not be housed at a juvenile detention center.
DJJ should be a last resort for someone. It should. I think we should have gotten them earlier to be able to provide adequate treatment that would get them on, a road to success and a road to recovery.
Well, the South Carolina Department of Mental Health provides inpatient mental health care to children and adolescents at its Williams S. Hall Institute at the Bryan Psychiatric Hospital. A spokesperson with the Department of Mental Health says William S. Hall is able to accommodate teens and children with physical disabilities, including mobility issues, children who are blind, deaf, or hard of hearing. However, Hall cannot accommodate patients who need a medical level of care. Judy.
All right, Ashley, thank you very much. In 2022, the South Carolina State Legislature set aside $20 billion in our state budget to build a new facility for youth at the South Carolina Department of Juvenile Justice who have severe mental health needs. At this point, it is still unclear when construction on that facility will begin.